This is the Professional Hypnotherapist Podcast, session number 008. Fiona Coyle, Chief Executive Officer, Mental Health Reform. Fiona brings to mental health reform her many years' vast experience, from community development in Ireland to international development in the United Nations and women's rights in the European Union. Fiona's commitment and dedication and her advocacy for human rights and mental health reform is second to none. Listen as Fiona educates and informs us on mental health reform. All of this and more on today's edition of the Professional Hypnotherapist Podcast. Welcome to the Professional Hypnotherapist Podcast, a production of the European Association of Professional Hypnotherapists. That's EAPH.ie. Welcome to Fiona Coyle, who is the Chief Executive Officer of Mental Health Reform in Ireland. Thank you for being here today, Fiona.
My pleasure. Thank you for having me.
Now, Fiona, mental health is very much in the media. You know, we're hearing about it in both printed media and visual media, and rightly so too. So how important, to ask a question, how important is our mental health?
Yeah, I think our mental health is fundamentally important, and I think that the pandemic has really opened up a conversation. It was often for generations here in Ireland seen as maybe something quite separate, something quite individual, I suppose, to the person. And discussions on mental health difficulties often focused on individual factors, and rarely was it discussed that the circumstances which people are born or live can affect our mental health. And I think the pandemic has made people realize of everyone has mental health, and that it can be impacted by external factors. So it's really great to see it having such prominence in public discourse at the moment, and rightly so, as you said, because we to say the saying, there is no health without mental health. You have to look at the whole being, both physical and mental health, and they are equivalent to each other in many ways.
Excellent. Now, you're the CEO of Mental Health Reform. Now, do you yourself have a background in health or indeed in mental health?
My own background, I'm actually a community development worker by training. So I've been working, originally working with kind of communities affected by drugs in Dublin. And then I moved to work in international development and in human rights. So I worked for the UN for a number of years, working in a country called Lesotho, working
Yes.
on human rights and gender projects. Yeah, and I worked for our Irish Aid, which is Ireland's overseas aid program, and been working on kind of very much kind of with human rights. And the last number of years I joined Mental Health Reform in 2020, and before that I worked in Brussels for 4 years, working specifically on women's rights. So yeah, mental health reform, we're the National Coalition for Mental Health in Ireland. So we're an umbrella body consisting of over 77 member organisations, and we very much, take that human rights perspective. So it's been really brilliant to take my experience of working in different countries in different contexts back here to Ireland, because there's so much, that can still be done. Like, people have a right to health, people have a right to mental health services. And in Ireland currently, our legislation is out of sync with international human rights standards. Our services are kind of underinvested in, and people have long waiting lists that they're facing. So it's been really interesting to kind of take some of that experience I've garnered over the years and look at it in the context of working towards better mental health services for individuals around the country.
Excellent. Well, you preempted all of my questions. But anyway, no, you mentioned, in terms of that, you're a coalition of 77 different member organizations. And also on your website, you mentioned that I'm reading here that the government is serious about its new mental health policy, that's sharing the vision, and wants to make those recommendations a reality. Investment is needed.
Yeah, like high quality services need high quality investment. There's no other way around it. You need that investment, and for years it's generally agreed that there has been underinvestment in our services in this country. It hasn't been prioritized politically, and COVID has really exposed some of the gaps in the system. People would say that before COVID, we had a mental health crisis, and we're what we're facing into is perhaps increasing demands for a number of years to come. So we really need that investment. There's a lot of talk, there's a lot of support for
Yeah.
mental health, but unless that's translated into actions and into money, new money on budget day, services can't grow and can't develop without new money.
Yeah, indeed. And why do you think, you mentioned there's lots of talk and lots of, talking about it. But why do you think mental health, is way down on the pecking order?
Yeah, I suppose if you kind of take a bit of a historical perspective of mental health in this country, like in the 1960s, we had more people in mental health institutions than anywhere else in the world. I think the figure 1 in 4 you come across
Yeah,
very often.
that's
And
interesting. Yeah.
yeah, and that's not that long
No.
ago. And we started to transition, like the UK and like other countries,
Mm.
away from that model, really kind of going towards like a more community model into the 80s and then the 90s. And that led to the launch of what was then seen as a really important document, the vision for change, the mental health policy, that really was moving away from institutions and led to the closure of a number of institutions across the country. But the vision was that you would move away from institution but build up those community mental health services.
Uh-huh.
And it was brilliant, a really brilliant document. But then Ireland went into an economic crisis,
Yeah.
and mental health wasn't prioritised, and the changes that were to be invested in and were to be brought forward, it never quite happened, and we're still struggling from then to now
Yeah.
to really start building, those services. Yeah, like I think there's obviously challenges that are faced within the services in relation to recruitment of staff. That's a challenge for for the health service more broadly. But I think that's led us to where we are today. Unfortunately, that policy was launched at a moment in time when the country was just on the verge of a crisis, and the funding, instead of increasing, actually got cut across the board,
Mm.
and we're still recovering from that period.
Yeah. Do you think, Fiona, that there's still that stigma about our mental health?
Most definitely. And I think sometimes in Ireland, we might pat ourselves on the back a bit too soon and say it's brilliant. More people are talking about mental health. We've got celebrities speaking out. We've all these campaigns. But when you speak to people, especially people who have maybe more severe and enduring mental health difficulties, the stigma and discrimination that they face, it's still very real,
Mm.
and I think like I mentioned, the 1960s, like that's my parents' generation. And the stigma of that time of having a family member in an institution was huge. And, people weren't institutionalized. Like the evidence shows they weren't, institutionalized for mental health difficulties alone. Some people perhaps, they were gay or lesbian, or some people for just being poor,
Yeah.
they were
Yeah.
put in institutions. So that stigma, that takes time to move away from that.
Mm.
And that's kind of 60, 70 years. We're moving in the right direction, but we still need to demystify a lot of things,
Hmm.
around some of the kind of difficulties, and some of those who have more severe and enduring mental health difficulties, that people are comfortable with it. So much of our knowledge comes from movies or TV programs where
Hmm.
things are sensationalized, and that's
Yeah.
not always the way.
Mm.
So we need to open up a more genuine conversation, I think, and be a more accepting country, for people with all types of difficulties.
Yeah. And how do we open up that conversation, in your opinion?
I think it's giving more space to people who have those difficulties, and who've recovered or are on their own recovery journey. Like there's wonderful initiatives like the Green Ribbon campaign, which is ongoing currently, has the aim of doing just that, of breaking down the stigma. That the work that C Chain does throughout the year is really important in that regard. So it's bit by bit, I think. And a lot of the work that we do as well is, mental health. It's not just the Department of Health, but it's not just for them. We need a real cross departmental approach. So it's equally as important, that there's so many people now, who are living with mental health difficulties, who could live independent lives, and there's no housing for them, or they're not able to get employment because of some of the stigma surrounding their difficulties. So it's really taking that holistic approach.
Mm.
It's not just about the kind of the mental health services. It's allowing people to live their best life, and like opening up conversations with employers, like to demystify, what it's like maybe employing someone with a mental health difficulty, that someone with a mental health difficulty actually feels comfortable saying to their employer, look, I have this. It might mean X and Y, or I might need this type of support, and they don't have a fear that they're just going to get fired, which has been the case, in the past. So there's lots of different ways, and I think it's people, educating themselves as well. What is mental health? Do I actually know what that term means? Or it's being used so much now that people may not know, what exactly it is, and they may be fearful of asking because they don't want themselves to be judged for kind of asking what they perceive to be, a silly question. So I think it's okay to ask, and it's okay to learn, and to be on a journey.
Yes, indeed. And to what extent, does language and labeling, come into the whole scenario? Because you use an expression there, the word difficulty. Now, that in itself can perhaps conjure up in people's minds a what I would refer to maybe a negative connotation. Is there, in your opinion, a different terminology that we could use?
Yeah, no, it's you're very right. Like words are so powerful, and the language is really powerful. Like as mental health reform, our preferred terminology, we do use mental health difficulties.
I
Now,
see.
I suppose other terminology you would hear would be, mental health illness, and we've tried to keep away from that language ourselves. Now we do say, anyone, it's up to if someone is living with a mental health difficulty, if they want to call it an illness or difficulties, up to them to determine the language that they're comfortable with. So we'll never, be prescriptive in that regard for
Okay.
what others use. But for us, we're very aware of moving away from medical terminology
Yeah.
because of, what kind of, we're trying to move away from a medical model in this country, and using that type of terminology is not, is not, I suppose, appropriate language. But, people react and relate to language very differently. And language, it can act as a barrier to prevent people kind of understanding and then maybe showing empathy or helping others. Like, I'm sure we've all kind of been using terminology like, oh, that's crazy, or that's nuts, or, that's something that's been very common, very colloquial type of language in the English language. But it can stigmatize communities, and it can stigmatize individuals. And I suppose by changing even some of that basic language, we can kind of help understand, open up kind of channels to understand other people's experiences.
Yes, indeed. And sometimes I like to, if you use to use a metaphor, if you use the metaphor of a boat, a rowing boat, and one oar is your physical health, and the other or is your mental health, and both of them should be pulling at the same rate so that the boat gets where it wants to go. So that's maybe some way of looking at it, in terms of our mental health and our functioning in a holistic manner.
Yeah, that's a lovely way of looking at it. Like, there's a huge intersection between both, and mental health. It is a continuum as well. You've everything from kind of people now. Some people are listening. Over the last 18 months, may have experienced kind of low level anxiety for the first time, or kind of low level depression. But then you kind of got a whole spectrum then towards kind of those more kind of severe and enduring difficulties. So even understanding that, and that it is a spectrum, and that at any one stage we could be anywhere on that, and any of us can move along it. And yeah, it's how it intersects then with their physical well-being is really important.
Now, in terms of mental health reform, you have, I suppose, you have a mission and you have let's say, a vision. So, how do you go about affecting or implementing your mission and vision?
Yeah, so I suppose just what we're trying to do is trying to ensure that, we live in a country where every individual, no matter where they are able to achieve their best possible mental health. So that's the goal. That's what we're moving towards. And what we do then within that we're, as a coalition, we try and bring together our members and speak with one strong voice, which we all know is so powerful, to drive that reform of our services and our supports. And I suppose on a day to day, that all may sound a bit abstract, like on a day to day level, what does that look like? So, we do a lot of policy submission. So we try and change and reform the way that services are set out in policy. So to, not just with the Department of Health, but, we do policy submissions to the Department of Justice, of Housing, Employment, just so that mental health is considered. So we bring our members together and use that collective expertise to feed those submissions. We also really put a huge importance on people with lived experience and their families, friends, and carers. So in everything we do, we really try and ensure that we're being reflective of some of their experiences. So we have a grassroots forum, which is comprised of service users and their family, friends, carers, and supporters. And a number of years ago, which you may find interesting, we did the first of its kind study in Ireland called My Voice Matters, which looked at the experience of service users in accessing services in this country. So, what are people's experiences? And that was really insightful. And, so much came out of that, that people, even when they're in the services, they feel like their voices is perhaps missing, and that's what we're moving towards in this country in our new mental health policy is services where it's a partnership between the service user and the service provider, because each person's mental health journey is unique. So the services have to cater for each person individually. So that's kind of, we do our own research, and then we do a lot of campaigning. So, at the moment, what we're campaigning for is for the government to invest €85 million in additional money in our mental health services in budget 2022 in a few short weeks' time. So we kind of bring our members together and try and make your voice as loud as it can possibly be to ensure that mental health remains on the top of the priority list.
Okay. Now, on and that happened in terms of that you launched your pre-budget campaign on Tuesday, the 31st of August. Isn't that right?
Yes, we did. We did it outside Leinster House with some of our members and service users, and then we had an event, a virtual event, as all events are these days, where we had. We had people, a wonderful activist called Mary from the west of Ireland, share her experiences, and we had some insights from some of our political allies, if I can call them that. So Senator Francis Back and Deputy Roisin Shortall and Deputy Nessa Horgan as well joined us for that event, which was brilliant. It was a great start to our campaign.
Now, you also mentioned on your website the currently apparently Ireland is spending 5.1% of the health budget on mental health, and you want that increased to 10%.
Yeah, 10%. It's not just our ask. This is the government's own commitment. Under the Sláinte Care document, they've committed to investing 10% of health budget in mental health. And, as I said previously, high quality services demand high quality investment. And, the 10% figure, actually, the WHO, they recommend that mental health spending should be at 12%. In the UK, they spend 13%. In other countries in the Nordics, it's 13 up to 15%. So our spending, it is very far behind where it should be, in our opinion. And we'd like the government. We don't expect the budget to be doubled overnight, but we'd like a plan in place. We'd like that commitment that there's a recognition of we need to get to X. We've said this is our own recommendation. How are we going to get there? Are we going to try incrementally increase our spending year on year?
Okay. Now, that's one of the steps. I think you have 9 pointers there to what do governments need to invest in. And the first one I can read here is that it's 10%. You want a budget increase to 10%. There are also like increasing staff levels across mental health services. Can you just briefly go over those points, if you don't mind?
Yeah, no problem. So, I suppose our mental health services predominantly, there are staff-based services, and staffing, across the country, community mental health teams have huge staffing issues. And we need to have new money to put new staff in place. Now, I will also acknowledge that this is a difficulty. There is a difficulty in recruiting certain types of staff, but we need to look kind of creatively at how we can engage staff across Ireland. Primary care is another huge area of investment. Like currently, people's first port of call most often is to go to their GP to get their advice, and the GP will put someone on a waiting list for maybe primary care psychology. There's over 10,000 people on that waiting list currently. Majority are children, and half of those, more than half, have been waiting for more than 12 months to be seen. So that's really important that we're investing in that primary care. Then we hear so often in the media, talk about our child and adolescent mental health services. CAMS is the acronym you might hear. Again, long waiting lists, for children. So they need to be invested in. The community and voluntary sector, like over the last 18 months, many of our members moved their services online overnight, going from face to face to virtual, like developing new types of services. And the last year, there was additional support there, but we're moving into a period now, like there's no going back. The previous model of delivery, there's no going back because we've learned so much. We've started to dip our toes into e-mental health, into innovation. But, that's costly. It costs money for community and voluntary organisations to develop new services. And they've also been reporting, our members have been reporting an increase in demand for their services. So we believe, we're calling for money to be invested to support the community and voluntary sector. And then we have other asks kind of specific to different areas. So advocacy services, we've been calling for years. Like often it can be a very difficult and very lonely journey, someone navigating their mental health services. And in other countries, we've seen an independent advocacy service can really help people. So someone who's on your side who can help you navigate the services. So that's something we've been calling for a number of years, but there doesn't seem to be an appetite there at the moment to set up such a service, but could just really transform, I think people's experiences. Then, investing in kind of affordable housing, in employment supports, and also in terms of, in really scaling up the mental health services and for those who are in the prison system. There are so many individuals at the moment who are in prisons who shouldn't be there. They need different type of support and they're not getting it. So, there's a lot there that can be done with the 65 million. We're calling it's 20 million to maintain the services as they are today. Costs go up, things happen. It could cost 20 million to run today's service next year is what we believe. And then the additional 65 million, that's a lot, can achieve such a lot with that money, as you just heard.
Yeah. And it's interesting, you mentioned there about the prison population, because I don't have the statistic, but I'm sure quite a large percentage of people in prison, that they have a mental health issue, no doubt.
Yeah, I think I don't have the statistics in front of me either, but yeah, I do know, like in terms of the prison system, it does disproportionately, I suppose, have a disproportionate number of people living with mental health difficulties in the prisons. And, like what we've been calling for and what some of our members have been calling for is that, they need to be diverted at the earliest possible, with their first the various possible junction, they need to be diverted away from the justice system into the health system. And you can, we know that that's not happening because, the pressure that is on the Central Mental Hospital at the moment. There is, a new hospital just opened in Port Ryan, but already we're hearing from those who work in that system that there are, there are like not enough beds. And I think one of our members, the IPRT, the Irish Penal Reform Trust, found that the lowest number, this is in July 2019 to July 2020, the waiting list from prisons into the Central Mental Hospital, the lowest number was 20 service users waiting to be transferred in, and the highest was 33. So that's really high. 20 people who are in a prison who are really, when you go into that central mental hospital, you have, severe difficulties and you need specialized support. And the fact that those 20 individuals were in an environment which would be, I think, severely distressing for them, but also for their families and communities to think that someone isn't getting the support that they need. But yeah, this is something, again, for years that we've been highlighting that there hasn't been a huge amount of change on. And I suppose, unfortunately, when you talk about the prison community, it's not a topic that gets maybe the gets into public discourse as much as it should. But people's rights are being violated.
Mm-hmm. Now, what comes into my mind is that as therapists, and specifically hypnotherapists, we would deal with clients who are not having their needs met. And it's when you're not having your needs met, something goes awry within ourselves, and perhaps it's a mental health issue that happens, or something else. So that's my take on it. And what's your take on that in terms of having our needs met?
Yeah, like I think that's exactly it. It's this kind of, how the external factors that are so important in all of our lives that, if our needs are not met and if needs are not being met by the very system that's there to meet them, that's a huge challenge, and that's something, needs to be prioritized in this country. And there's an opportunity now to do so because there's so much discussion on mental health. I think before there wasn't an understanding of its importance. Well, now, you speak to people and they're like, yeah, mental health, it's so important. So there's a moment here to capitalize on. So I think, it's quite positive in that regard. It's one of the, if I can even dare to say, one of maybe the more positive aspects of what we've gone through is, the realization of the importance of mental health, of all of us at an individual level, investing in it, and then at a societal level, prioritizing it.
Yes. And you touched on it earlier with regard to, the voluntary sector and the huge value that volunteers give in various different aspects of Irish life, but specifically, for example, Samaritans, Pieta House, and volunteers who do the work there. And I often think that if you were to monetize that work, it would be worth actually millions.
Yeah, like I think Ireland has always really rightly prided itself on, its community spirit, and certainly, over the last 18 months that did not disappoint. We lived up to it. Like you've seen such wonderful stories of, people delivering medicine or food to neighbours, and so many of our member organisations are so dependent on the work of volunteers. And yeah, like the Samaritans in particular, like, the work that they do, we launched our campaign in Waterford with the kind of the Samaritans in that region. And, they've answered more than 560,000 calls last year. that's such a significant number of calls. All of our members, like, they provide such valuable support across the country, and really needs to be commended. But also, I think what's kind of where they're doing such a wonderful job. Like, we can't over rely. The Samaritans should not be. The public services should be there equally to assist individuals. It shouldn't be an either or. Like, they shouldn't be filling that gap. We need to ensure the public system, the work of the Samaritans is so important and so complementary to that. But, we do need to ensure that that the public system is strengthened so people get the support that they need at the right time.
Yeah, that's an excellent point in terms of that we shouldn't really be relying on, the volunteering sector for, let's say, an absence of or inaction on the part of the government.
Yeah, that's exactly it. Yeah.
Now, and maybe just to recap a little bit, I noticed the statistic there for CAMS. There's over 2,700 children on a waiting list.
Yeah. And that's, if you can think about it, that it's sometimes when you hear numbers, you forget that behind each of that number is a child who has a family, who goes to school more than likely, who lives in a community. And, the impact that has, that the person isn't getting the support, it impacts all of that ecosystem. But yeah, it's one of the big challenges in this country for, last number of years, and continues to, I suppose, to be a blot on the jotter of successive governments, that they haven't quite managed to invest in that area and to get those waiting lists down.
Okay, Fiona, now going forward, what's the route forward in your opinion?
I think there's huge, to be positive about it, there's huge opportunity there. I think, this is a top issue in this country at the moment. Like, I think RT Primetime did a survey asking people, what are their top areas of concern. The New Normal survey, I believe it was called, and mental health came in fourth, while it never appeared previously in any of those surveys. So there's a moment for what we need. We need investment. So we need the government to, invest in Budget 2022. But money alone, we need to be realistic. Money, the investment is crucially important, but we also need the leadership behind that, both political leadership, but also one of the things we've been calling on is for a senior director level position within the HSE, reporting in our health service executive, reporting directly into Paul Reid, who's the CEO, or whoever that CEO may be, who can move forward some of those structural barriers that are there, who can drive forward the reform. And, that would speak to HSE, who's taking mental health, giving mental health the same parity of esteem as it does to physical health. So, I think we need both of those levers at the same time, the investment and the leadership. We have a wonderful policy. We have, a public supportive of prioritising this issue, and we have an opportunity, once maybe in a lifetime opportunity, to change the system for both this generation and generations to come.
Excellent. Okay, Fiona, so how can anyone out there who's interested in getting involved in mental health reform or mental health per se, what in your opinion do they need to do?
Yeah, great question. And I suppose if anyone out there is kind of maybe nodding along to some of what I'm saying and wants to get involved and support our work, every voice matters. We need to continue to remind the political leadership in this country that this matters. So please go on to our website, mentalhealthreform.ie, follow us on social media, make your voice heard. On our website, there's an easy kind of call to action that you can share on your social media, or there's an easy way for you to contact your TD and representatives to let them know that you want mental health to be a priority in Budget 2022. So mentalhealthreform.ie, and all the information should be there.
Thank you, Fiona Coyle, CEO of Mental Health Reform. You have been listening to the Professional Hypnotherapist podcast. Please stop everything and start exploring to find the right solutions for you at eaph.ie. You know you want to make positive, beneficial change in your life, and yet you may not have the know-how. Allow yourself to discover how you too now can start that change process and begin to reap the benefits through ethical hypnotherapy.